So before we continue, can someone type in what he or she knows CPR to be? Your understanding of CPR, what is it? Or you can ask me to unmute you. Just give us some few seconds description of what you know CPR to be. Anyone ready to give that a try? Hello, are you with me? Kindly unmute yourself and tell us what you think CPR is. Just a few more seconds, then I can go ahead. Okay, in the absence of any trial, let's carry on. So, basic life support. Can you all see my screen, please? Hello? All right. Let's go ahead. Basic life support is defined as a sequences of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary or cardiac arrest until the person can be given full medical care at a hospital. It doesn't involve giving the person any medication or any invasive skills. So this simply means that basic life support is the care or the attention that is given to someone who has cardiac arrest or pulmonary. When we talk about cardiac, that means we're talking about the heart. If we talk about pulmonary, that means we're talking about the lungs or the respiratory system. So if there is any sudden shutdown of any of these two systems, that means the person needs basic life support. So we're not giving the person any injections, no tablets, no invasive procedures, just some procedures or some activities to help restore the circulation and the respiration of this patient. And cardiac arrest continues to be a problem all over the world. I know most of us would have experienced a particular situation whereby maybe somebody falls down and all of a sudden loses consciousness. Sometimes you watch people fall like that and they die. Most times people around don't even know what to do for this person. So this is, if it happens from the heart, that means it's cardiac arrest. And most cardiac arrests occur outside the hospital premises. The best survivor is always teaching everyone, everybody, even the children should know how to do CPR, because nobody knows what is going to happen in the next minute. I can remember several years ago, we were at an ordination, just a religious program, and one of my uncles slumped. We started this CPR for this man, and we revived him, and he stayed for several years more before he finally passed. So this is to tell you that everybody needs to have this what is involved in the CPR at your fingertips, because you don't even know where it's going to happen. Most times it happens outside the hospital. So whether you are a bystander, whether you have seen it happen before, whether you have seen someone doing this CPR, whether you've been opportune to see people revive with the CPR, you need to learn it. It could be a family member that will just slump, and you notice that this person is not breathing again. If you can start this CPR in the first minute of the slumping, you have increased this person's chances of survival from the cardiac arrest. So CPR simply means cardiopulmonary resuscitation. That is resuscitating the person's heart and resuscitating the person's respiration. Sometimes it comes together, but sometimes they come differently. It could be just the heart that stopped working and the person is still breathing, or the person is not breathing and the heart is working. So whichever way it is, after this lecture, you should be able to know what to do for this person. And not only what to do, you need to also teach others. You know, instead of talking about some things that are not very important, you can start up this discussion after this class. You will be equipped. When you have listened attentively to this class, you will be equipped with every information you need to carry out this CPR and to also teach others. So looking at this slide is telling us that it is not only medical personnel that are trained to do this CPR. It can be provided, these services can be provided by anybody at all, including the paramedics. Anyone at all can do it. You can do it anywhere, but you need to start as soon as possible to increase the person's chances of survival. The purposes of the CPR, like we have already said, the CPR is cardiopulmonary. Cardio is the heart, pulmonary is the respiratory system. So the purpose is to maintain circulation. So if you are able to help the heart to continue pumping this blood, that means you are maintaining the circulation. If you are able to help the lungs to also increase and deflect, thereby oxygenating the blood, that means you have helped in maintaining the oxygenation of the blood. So that is the main purpose of the CPR. So what are the indications of the CPR? It is not everybody that you start doing CPR from. Some people will go to a club and drink to stupor. The next thing is they have slumped and they are unconscious. So you don't do it. You don't do this CPR for this set of people because their heart is completely working fine and their lungs are also working all right. So this particular person doesn't need the CPR. But if upon assessing this patient, I will teach you how to assess this patient to actually know if this person is in need of the CPR. So there has to be cardiac arrest. The heart has to have stopped working, or the lungs would have stopped working, or the combination of both of them. So currently, the sequence of CPR is what you can see on the screen now. First of all, you take care of circulation. The next one is the airway. The other one is the breathing. You know, initially it used to be airway, breathing, and then circulation. But for now, the current best practice for CPR is that you take care of circulation first, then you take care of the airway, and then you take care of the breathing. So the actions, things you must do if you're going to start the CPR. The first thing is to assess the scene. Make sure the scene is safe for you as the person who is going to conduct this CPR for the patient or the person who has collapsed. So make sure the scene is safe for you, because if the scene is not safe for you, you cannot function optimally and the aim would be defeated. So watch for safety, remove every obstacle, remove everything that can cause harm to yourself and to the person who you are attending to. Then the second one is to determine the responsiveness of that person. Like I have previously noted, you must check if the person is breathing and if there is heartbeat for this person. Then you will, after assessing all this, you can now decide whether to start your chest compressions, which is the CPR. After doing your chest compressions, you open the airway and check for breathing and then deliver breath. We are going to explain all these topics, all these steps. So if you look at the screen now, you find an adult lying on the ground. So when looking at this person, the first thing you have to do is to check for safety. Then come close to the person and assess for responsiveness. So when you assess for responsiveness, you're checking two things. Can we type in what you are checking for when you're assessing for responsiveness? I'll just give a few seconds while you type it in. What two things are you checking if you're assessing this patient for responsiveness? What are you looking at? What are you expecting to see or not to see? I need some answers so that I'll know that you're hearing and you're understanding me. If you are assessing someone, you suddenly find an adult lying on the floor and you have the intention of starting CPR for this person. What are you going to assess for to know if you are actually going to start or not? Can someone help us? Okay. Okay, someone said breath, which is correct. You're going to assess if this patient is breathing or not. What else? After assessing the breathing, what next? Consciousness, all right, that is also part of it, but there are two important ones. Breath is the respiration, which is the pulmonary. The next one is the cardiac activity, if this patient's heart is still functioning. So thank you for all those who have contributed. I'm happy you are following us. So first of all, assess scene safety and then assess if patient is breathing and if there is heartbeat. Those are the two major things you assess. And then for responsiveness, you can shake the person, shout to the person's hearing, are you all right? Or you call the person's name if you know the person. Then while assessing for that consciousness or responsiveness, you are also trying to assess if this patient is breathing. If you're close to someone who is breathing, you will know by the rise and fall of the person's chest. The next thing you also now check is the circulation. And this is how to check for the circulation. You place your fingers at the carotid pulse point. Check only for 5 to 10 seconds. Don't let it pass 10 seconds because the more time you waste, the lower the chances of survival for the person. CPR is always best when you start as soon as possible. So as you have assessed the environment to rule out any danger. You have assessed the consciousness, the breathing, and then this is you assessing the heart rate, the cardiac activity. Now, if the heart is still working, just put 2 fingers at this point, at this carotid artery point. You'll feel some pulsation. You feel it moving up and down. You don't need to press it too much. Just feel it. You will see, you will notice some movements there if there is cardiac activity. So as you're checking for all these things, you can as well shout for help. If there is no pulse, and if there is no breathing, or if the breathing is abnormal, we all know when breathing is normal and when it is abnormal. When it is abnormal, maybe the rate is reduced or it is irregular. Maybe the person is breathing a little and then stopping, or one breath can take the person 2 seconds to finish. You know, when you notice that kind of thing during your assessment stage, you know that this person definitely needs the CPR. But if you call the person and the person is answering you, that means the person is conscious. That means the heart is working. That means the lungs are working. So this person doesn't need CPR. But if you have called the person is not responding, definitely this person is unconscious. You have checked, the person is not breathing. You have checked for the carotid artery, there is no movement. That means this person definitely needs CPR, cardiopulmonary resuscitation. So to start, you don't just start CPR in any position. If not, you end up harming this patient. If you look at this picture, that is how flat the person should be lying. So to start this CPR, you need to place this patient in a supine position on a firm and flat surface for the patient's safety. Because if the patient is not on a flat surface and you start this CPR, you're going to fracture the ribs or cause a problem to one of the organs, one of the internal organs. So if you had now laid this patient flat, you can now kneel down beside this patient. That assuming the patient is lying on the floor. That is exactly what you're going to do. You make sure the patient is lying flat, kneel beside this patient, locate the position for the chest compression. We are going to see the position. So if you look at this picture here, that's the exact position of the chest compression. You don't just start the chest compression anywhere. It must be at the correct position for it to have the full effect and not to harm this patient. So hand position for the chest compression. You also don't just put your hand anyhow. First of all, you lock your arms. Hang on. So first of all, you lock your arms like this. Lock them one on top of the other. Then with the heel of the one under, this is the place you're going to place on the person's chest to start the CPR. So that is exactly how you're going to keep your hands. Lock your hands and use the heel of the hand under and place it on the center of this patient's chest, between the nipples. Keep your elbows straight, just exactly how the person in this picture is keeping his hands. Your elbows should be straight, not bent, for you to deliver the actual compression you want. And your shoulders should be directly above your hand. Use your upper body weight, not just your arms, as you push straight down to the chest, at least 2 inches. This 2 inches is about 5 cm, 5 centimeters. They said 5 to 6 centimeters. That's how much you should press the heart inside, the chest inside, for you to deliver an effective compression. Now, the assignment, if you have a pen and a paper, just put down what you're going to do after this class. Go and get a ruler. We all know what ruler is, the ones that are calibrated in cm. Use it to check an estimate of what 5 to 6 centimeters look like. And then imagine it, that is how deep you're going to go when you're delivering the chest compression for it to be effective. Because if you don't go that deep, you know where the heart is located in the chest. And our aim of doing this compression is to get to the heart, to let the heart pump out the blood in the heart without leaving the heart to do it on its own, since this heart is not working at this point. So that chest compression is just you helping the person's heart to push out the blood for circulation purposes. So if you are able to get an estimate of what that 5 to 6 centimeters is, that is when you're going to be sure that your compression is effective. If you don't go as much as that, it's not going to give you the results you want. So you must get to 5 to 6 centimeters. But what happens when you go deeper than 5 to 6 centimeters? Can someone tell us? What do you think that is going to happen to this patient or this person having cardiac arrest? This person you're doing CPR for. If you go deeper than 5 to 6 centimeters, what do you think is going to be the resultant effect? Can someone tell us? Just type in. I'll be able to see it. What can it result to? Is it on the positive or on the negative? Just tell me your thoughts. If you go deeper than 5 to 6 cm, what will happen? Or what do you feel will happen to this person? Very good. Very good. So you might end up damaging the person's organ. That's what Henry has said. And the next person, Esther, said, you might break the ribs. That is one of the commonest complications of CPR. If you go deeper than that 5 to 6 cm, the tendency that you're going to injure the ribs. And under damaging the organs, the ribs, you may injure the ribs and the ribs will now puncture the heart. The patient that could have survived would now have worse complication than the cardiac arrest itself. Because if this patient starts having internal bleeding, the chances of survival will be lesser than it is. So thank you for all those who have contributed. I'm glad you're following the class. So the next, now look at what you have to achieve to make sure that the quality of your compressions is good. First of all, you press hard and fast. I'll tell you how fast. It's not just hard and fast. You need to monitor how fast you are. Your rate of compression, you also need to monitor it. So you need to press hard and fast. You need to also allow for full chest recoil with each compression. What it means that as you are pressing down, as you are doing this chest compression, when you press it down for one cycle, you need to let go so that the chest will go back to its normal level before you can start another compression. This is to make sure that the heart refills with blood, because as you have compressed it, it expelled every blood in the heart. And you need to give this heart some room to also welcome another set of blood. So if you allow for this complete recoil of the chest, that means you're giving the heart the room to fill up again with blood, so that when you compress again, the blood can go out to different parts of the body to supply the body. So allow for only minimal interruptions to chest compression. So as minimal interruptions as possible. In fact, as a matter of fact, if you see someone doing CPR, please do not distract that person. Even if you know who the person is, you don't distract that person, because the person doing this CPR is, number one, counting how many cycles am I going to do before I stop. So if you interrupt this person, just ordinary saying hello can make the person forget the number of compressions the person had already done, and the aim would have been defeated. So there is a number of compressions you should do before you do any other thing, and any interruption can stop you from, it can make you lose count of what you are doing. So no interruption from anybody or from yourself too. If you're doing this interruption and let's say your phone rings, you don't stop it to start answering the call. You leave it, because the priority at that point in time is to save that life. So now let's talk about the chest compressions. How many are you going to, or are you expected to give? Are you going to just start doing this chest compression indefinitely? No. You are expected to give 30 chest compressions in a cycle of CPR. And the rate is about 100 to 120 compressions in a minute. That means if you're giving 30 chest compressions at a go, that means you're just giving about, it's going to be definitely less than 1 minute. But the way you will count it, you should give about 100 to 150. The rate should be about 100 to 120 per minute. But you're expected to give only 30 at a go. That is if you are ready to give the respiratory attention. Some people don't want to do it. But instead of you not to start the CPR, please leave the respiration. You can continue with the CPR. If you're not comfortable, some people are not comfortable to give mouth-to-mouth respiration. Some people don't have the airbag to do it. If you don't have, if those things are not at your disposal, continue your chest compression until you are tired, though we'll get to that. So for the airway, after the initial 30 chest compressions, you can assess the airway and see if there is any headway. For some people, before you even get to the 30 chest compressions, the person would have started breathing. So if the person has started breathing, you don't need to give the rescue breaths again, because the natural breathing is better than the artificial one, we all know. So if after the 30 compressions, assess the airway, assess the breathing and see if the person actually needs it. If the person is still not breathing, then establish airway by pulling. You see how on this picture, this person is pulling the chin up. This is just to establish airway, to make the airway to be clear enough. Then you can give 2 rescue breaths. As you are giving the rescue breath, you don't just push air in and bring and stop. No, you need to make sure that the chest is increasing in size. The chest is rising. The way the person will breathe and the chest will expand, that is exactly what you are expected to notice when you are giving this rescue breath. If it doesn't happen, that means the rescue breath you gave was not effective. So you need to tilt, just exactly what this person is doing. Tilt the chin up. Make sure you block the 2 noses with your 2 fingers. If you look at this picture very well, you see this person has closed the patient's nose so that the air you are breathing in does not come out through the nose. That's the essence of pinching the nostrils so that the air will not escape. So you give 2 rescue breaths. The first, what are you going to do to make sure that the breath is effective? That is making sure that there is visible chest rise. Make sure that the chest has taken there's a movement in the chest, indicating that some air were introduced into this person's lungs. So there are different types of rescue breath. So we have mouth-to-mouth breathing. If there is a barrier available, you can put it over the person's mouth, pinch the nostrils, and then do mouth-to-mouth, making a seal using your mouth over the mouth of the patient. Or you can use a pocket mask or a bag mask. You know, some people are not, they don't want to do this bit of the resuscitation. But instead of you leaving out the chest compression and respiration, respiratory effort, because you don't want to do it, please do the do the chest compressions. But if you're all right to do the mouth-to-mouth, you can do it. But if you're not fine with it, don't force yourself. It's good to do it, but if it's not convenient for you, or you feel you are at risk, depending on the situation on ground, you yourself know, you are the one that has assessed the situation and know what is best for you. So if you can do this mouth-to-mouth, that will be absolutely fine, because what it's going to do is that it's going to help introduce more oxygen into the person's bloodstream, so that as you are now compressing the person's heart, the person is delivering not just ordinary blood to the body organs, it is delivering oxygenated blood. So apart from the mouth-to-mouth, there is also bag and mask ventilation, whereby you use that if this is available. This is exactly how you're going to place it. The first one is you're going to form a C shape with your thumb and your index finger. Can we all see the picture? That is what you're going to place on top of the mask. Then the next thing is you're going to apply gentle pressure down and form an E with the rest of the 3 fingers. We call this the dominant hand is going to be the one you're going to use to inflate the bag, the air bag. But the one you're using to hold this object here is non-dominant hand. So you form a C, first of all, with your index finger and your thumb. Then you form an E shape with your 3 fingers just under the person's jaw, under the person's mandible, just to hold it in place. You're just trying to make sure that the air you're going to pump with the airbag is not escaping from anywhere. So this is exactly what we just explained. Make sure you form a very good seal so that the air doesn't escape. And even as you're delivering, even as you're pressing the airbag, you also make sure that the chest is rising and falling. Because if the chest is not rising and falling, you are not doing anything. So rescue breathing. Each rescue breath should last approximately 1 second. So you're just using 2 seconds to give the 2 rescue breaths. So try as much as possible to make it fast. The faster you are with what you're doing during this CPR process, the better the chances for that person to survive. So now, this ratio is very important. 30 chest compressions to 2 rescue breaths. So if you're lucky to see someone who is going to assist you in this CPR, you can give the person to carry on with the rescue breath while you continue with the CPR. After doing for some time, the CPR is really exhausting, especially the chest compression. So if you're exhausted, don't continue. you can switch roles with the next person. But if you are the only one doing it, you know that you're the one doing the chest compressions, you're still the one doing the rescue breath. Just make sure that you are as fast as you can. Now, the rate and the depth. Not too fast and not too hard. We have already explained why we shouldn't make it too hard. And why you shouldn't make it too fast is so that you give room for the heart, for the chest to recoil, for the chest to go back to its normal state, for the heart to refill with enough blood so that the next compression can then push the blood out again. So the depth is 5 to 6 cm. The rate is 100 to 120 per minute, but you're not delivering this 100 to 120 at a go. You're just delivering 30 and then giving the 2 rescue breaths. So how long should you do the CPR? That is one of the questions people ask. How should I continue indefinitely? When should I stop doing this CPR? Like I mentioned, it is quite exhausting. So the first thing is you're going to continue doing this CPR until qualified help arrives and takes over from you. If you are in an environment where you can easily call an ambulance and give the ambulance your postcode, and the ambulance will come within few minutes to take over from you, that means you're very lucky. But if you're in some other environment, please, can someone tell me the emergency number for ambulance in Nigeria? Someone please help me. In case you see someone that has collapsed and the person is unconscious and you have assessed and you're doing CPR for this person and you're expecting ambulance to come or qualified help to come, what do you do? What number do you call? Please type it. I very much want to see it. 112. Who has ever called 112 and they came? And how long did it take them to come? Any answer? Has anybody ever witnessed someone calling 112, or you yourself, you have called 112 and they came and they did something? Nobody. Okay, did they come? A friend called. Did they come? And how long did it take them to come? I mean, when you called them, did they come? How long did it take them? Oh my. They came after the incident has ended. Okay. You see, one thing, whatever I'm going to say now it may not be directly related to this, to what we are saying, but we'll still get back to what we are saying. So if you're in an environment that no such help exists, because I practiced in Nigeria for over 14 years before I left. So I've never seen where they called an ambulance and they came. I've never witnessed it. So if you're in this kind of environment and you see this kind of opportunity to learn how to do this, please try your best. Even if it means paying to learn it, pay to learn it, because it can happen to anybody. I've heard stories of people that slumped and died, and nobody around knew what to do to this person. See, your safety is in your hands when you are in an environment like Nigeria. You have to be responsible for yourself. Like this class now is not just for you to see the questions and pass them in the exams. No, it is a life-changing experience, a life-changing knowledge. It could be anybody. I've witnessed it several times. One happened when I was 7 in the camp, when we're still in the camp. A couple was taking part in, participating in one of the activities, and she slumped. I personally started this CPR. When I did it for some minutes, she started breathing and started, the heart rate came back. So we now took the lady to the clinic, and the lady was all right after that. So had it been this person, it happened to her when there is no person with this knowledge of CPR, the person would have died. There's no two ways about it. And the next thing is we say it is the person's destiny. Sometimes it may not be the person's destiny. You see this, whatever you have learned today is free of charge. This topic now, this lesson is free of charge. But if you can apply the knowledge, it is not only when you have experienced this or when your loved ones have experienced this. If you have the slightest opportunity to pass across this information to another person, please don't hesitate to do it. It has been saving lives. It will continue to save lives because we continue to have hearts and circulation, and we continue to have lungs, and we breathe. And those two things can stop at any point in time. I've worked in the emergency room here. On a particular shift, we had like 4 cardiac arrests. And once any cardiac arrest happens, you see alarm all over the hospital. Everybody will be running helter-skelter. Bring this, bring that, bring this, bring that. And these 4 patients recovered. That's the beauty of it. Because everything is in place. Oxygen doesn't, I don't know their source, but it doesn't finish. But I've also worked in a hospital in Nigeria where in the whole government hospital, there is no single oxygen, even the airbag. If we manage to have the nasal cannula, we are using only one for maybe as long as we get a new one. You see the nasal cannula turning into brown, and people are still using it because there's no replacement. So if you find yourself in that kind of environment, please learn how to help yourself. Learn how to help others. Learn how to help your loved ones, okay? So let's continue. Continue resuscitation, continue this CPR, continue the rescue breath until qualified help arrives and takes over from you. Also, you can stop if you notice that this victim has started breathing normally. You don't need to continue. Started breathing normally and the heart rate has come back. Like the 2 that I personally was the one that delivered the CPR. They came back normally. The heart rates and the respiration, both of them came back. Or you have to stop if you are exhausted, because we don't want to start doing the rescue breath and CPR for you because you're trying to help another person. Do you understand that? So those are the situations when you can stop the resuscitation. The first one is when help arrives. It could be qualified help. It could be another person telling you, oh, hang on. Imagine in a situation, in a society, especially back home in Nigeria, when everybody knows how to do this CPR. You won't get tired. You won't be exhausted because you can do it for one cycle. Do the 30 to 2, 30 to 2, 4 or 5 times. Another person will volunteer and say, okay, wait, let me do it. And you'll be very sure that this person is going to deliver the CPR effectively. Because one thing is knowing how to do it theoretically, Another thing is practicalizing it. That is why I said you should go and get your ruler. Check the depth of 5 to 6 cm and imagine how deep you're going to compress. Don't go further than that. If you don't get up to 5 cm, the only thing you're doing is you're not getting to the heart. Even if you're getting to the heart, you're not like helping the heart to pump out the blood. You're just touching the heart a bit and you're not doing anything. So you need to know this, both the theoretical aspect of it and then the practical aspect of it, and then pass the information across to others. So if as many people know it as possible, you will not be exhausted because there will always be someone to help out. So there's another thing coming up on the screen here. The AED, Automated External Defibrillator. Please, can you indicate if you have ever seen this before? Have you ever seen it before? Or have you ever seen where it is stored, maybe in a public place, and they wrote AED stored here? Have you ever seen it before? Not seen it used before. I've not asked about using it, just seeing it physically. Have you seen it before? Yes or no? Just tell me, type in yes or type in no if you haven't seen it before. Hello? Have you seen this AED before? Are you hearing me? Are you hearing me clearly, please? Hello? Okay. Okay, only one person replied, not seen it before. Okay. So this is called Automated External Defibrillator. It is a device that has the ability to detect irregular heart rhythm, and it automatically delivers a defibrillation shock to stop irregular heartbeat and allow a normal rhythm to resume. And they are designed they can be used by anybody. You don't need to go for special training to start using it. You don't need to be a nurse or a doctor to start using it. Anybody. It is designed in such a way that anybody can use it. So it helps to shock the heart. It delivers some shock to the heart so that the heart that is not beating regularly, the shock can help the heart to start beating normally. So that's exactly what it does. So if you can have a look at this, at the picture on the screen, this AED has two parts. Make sure you remove the patient's clothing first. The patient you're doing the CPR for, you can use this AED to make your CPR more effective. So you carry on with the CPR until this device is made available. So in an environment where the AED is always available, even before you start CPR, you can, as you have assessed and know that this person is going to need the CPR, another person can start attaching the pads. So the first pad is always attached at this point below the left armpit. The next one is attached on the right chest, on the upper part of the chest. Those are the two parts. Once you attach it, you continue your chest compression. the AED is going to monitor the heart and know when to deliver the shock. And the AED is going to talk. It speaks out. It has a voice that you can hear. If it wants to deliver a shock, it will tell you, stay clear, a shock is going to be delivered. At that point in time, everybody should clear off, because that shock that is going to deliver to this person can kill a normal person. I've watched a documentary whereby ambulance crew were called to help a patient who went into cardiac arrest. They started doing the CPR and as well as attach the AED. The person's friend who was there was crying and crying, as they said, when the AED said, stay clear, shock to be delivered, they asked the lady to hang on. The lady still touched this person and the shock was delivered, and that lady died on the spot. So that is how bad the shock from the AED can be, unless these pads are attached at the appropriate point. So if you touch this patient while the shock is being delivered, that shock can kill the person. So once they said, AED says, clear, stay clear, a shock is going to be delivered, please, both you yourself doing the CPR and every other person, stay clear. If the person is lying on the bed for the CPR, nobody should touch the bed. Just stay clear and allow the AED do the work. So once the shock is delivered, for the number of times that I've witnessed the AED, only one shock returned the irregular heartbeat back to regular. The occasions I've witnessed it, just one shock. Sometimes they will need 2 shocks. Sometimes they will need several shocks. But if after several shocks, the person is still not having regular heart rate, they can look for an alternative, especially when help arrives. So when you have finished doing the CPR, unfortunately for you and for the victim has started breathing normally and the heart rate has also returned. The next thing you have to do for this person is to put the person in recovery position. And how do you put someone in recovery position? The first thing is put the arm, the right arm. If you want to turn this patient to the right, put the right arm exactly in this position. The next one is you're going to use the left arm, fold it just the way this person has folded it. This is the third stage. You're folding the left leg and then you're moving that person to the right side. The benefits of keeping this person in a recovery position is going to help if there is any drainage, if there is any secretion from the mouth or from the nose, the person will not choke on it. With gravity, the secretions will just go out by the side. That is the benefit of keeping this person in a recovery position. It also helps to enhance breathing. So, in conclusion, taking the right action quickly and confidently and effectively too can make the difference between life and death for a person dealing with cardiac arrest. Thank you for listening. So we have just come to the end of that lecture, and I believe we might have 1 or 2 questions. So we can entertain some questions now. If you want to talk, you can unmute yourself or raise your hand, I will unmute you. But if you want to type it in, you're also free to do that. Any question? Or any part of the lecture you didn't understand? or any comment? Someone said, thank you, ma. Thank you, John, Susan. God bless you. Hello. Or we didn't learn anything tonight. Okay. Thank you very much. So no question. Should we carry on with the next part of today's session? Before we continue, if you learned something, now tell me what you learned. Talk this time. And so just briefly tell me what you learned tonight from what I've said so far. Preferably type, but if you don't want to, sorry, preferably talk. If you don't want to talk, type. Okay, someone said, can this CPR measure also be used for someone that's drowned in water? Yes, it can. Until help arrives, instead of just looking at the person die. At least you have known that the lungs are not working. The heart is not working. Those are the two things you need to verify before you know whether to start or not. You just reminded me of the actor that just died recently, Junior Pope, that drowned. Instead of, in fact, at a time they said he's breathing. That could have been an opportunity to help him. Maybe that breathing was not normal. Like we said, if you assess and breathing is not normal, you should also carry on with the CPR. Had it been someone started CPR at that point in time, instead of snapping and videoing the scene, instead of taking the person, the young man to the native doctor, all those times are precious moments that were wasted. Had it been CPR was started, especially as they noted at some point that he was breathing, though the breathing was not normal, I think he could have benefited from CPR. So instead of, if you have assessed and you know the thing just happened, it just happened, it hasn't taken long, start CPR instead of not doing anything. But if you come and you witness someone who is unconscious and you assess this patient, and obviously the person has died some minutes ago, some changes have already started occurring, you don't need to start the CPR. I hope we understand this aspect. If the person is dead, clinically dead, no sign of life, and it has happened for some time, changes have already started, the person is cyanosis, the person is becoming stiff already. If you do the CPR from now till tomorrow, the chances is that you are just wasting your time. So that is why we need to assess and know that there is a need for this CPR before we can start. Then someone said, when someone has shocked, is it good to place the person on the side? What kind of shock, if you can explain it? Is it the shock from the AED or electric shock, normal electric shock? If you can specify, then I'll know what to answer. the shock you're talking about, is it the one from the AED or the normal electric shock that we know? So the next person said, when a patient is in hypovolemic shock, can CPR be a measure to relieve the shock? So if you have assessed this patient and the patient is in hypovolemic shock, assuming the patient is bleeding actively, and you know there is not enough blood in the person's system, the volume of blood has drastically reduced, it will reduce the chances of the person surviving from CPR. It's going to reduce it because something has definitely led to the hypovolemic shock. The CPR, the problem is not originating from cardiac arrest, is not originating from respiratory arrest. Those are the two major reasons why you should start the CPR. But I will say, instead of leaving the patient completely like that, you can start the CPR and ask for help to come. Okay, like the person, someone said like fainting. Hang on. Okay, the shock from fainting. If somebody has fainted, okay, if you really listen to this lecture, someone should answer this question that I'm going to put across now. If you happen to come across an adult who is lying unconscious on the floor as a result of fainting, should you start CPR? Someone should answer that. No, why? Someone has just fainted, just fainting, and you happen to see this person lying, fainted. Should you start CPR? Someone said no. If no, why? Can you tell us? Just say it before I explain it. It will give me a clue whether you really understood what we talked about. If someone fainted, should you start CPR? Rack your brain small. Yes, because someone can faint due to exhaustion. There are so many causes why one will faint. Okay, why shouldn't you start? Why should you start or should you not start CPR on someone who has just fainted? Just fainted. Okay, you know, most times fainting can be as a result of exhaustion. I think someone has mentioned, yes, can be as a result of exhaustion. Maybe it could be emotional. Or maybe the person is just hungry. Very good. So someone can die as a someone can faint as a result of hypoglycemia. So you need to assess before you start CPR. Please do your assessment first. Assess the environment. Make sure you're safe to start the CPR. Assess the patient. We talked about it. You need to assess if the patient is breathing. If the patient is breathing, good and fine. Then assess again if there is heart rate. If there is heart rate, should you start the compression, even if the person still seems unconscious? If there is heart rate and there is respiratory effort, should you start CPR? Now answer me. Who am I? John Susan, very good, very good. At least you have gotten it now. So you need to assess if the person is breathing by monitoring the rise and the fall of the chest. You need to, how do you assess if the person is, if the heart is functioning? We explained it, I showed you a picture. How do you assess it? Because I believe that at the end of this lecture, you should effectively carry out CPR. And you should also effectively teach others how to do it. So now we've talked about checking or monitoring for respiration, which includes rise and fall of the chest. So how do you assess if this person is, if the person has got circulation, if the circulatory effort is there, if the heart is functioning, how do you check it? From what we learned from this video, from this lecture, how do you check if the heart is functioning? Tell me. I believe CPR is an option for a patient in cardiac shock. Cardiogenic shock is the cardiac arrest and the rest of it. Rising and falling of the chest is for respiratory efforts. I'm talking about cardiac efforts now, cardiac activity. If the heart is working, how do you check it? I showed you a picture. Let me go back to that picture. Yes. See how to check for circulation. Can you see this? Can you see my screen? Okay, so this is how to check and be sure if there is circulation, if the heart is working. Palpate the carotid artery. Carotid artery is located at this point. See it? So if you touch it with your two fingers, just feel it. You see it pulsating, going up and down. Just once you see that movement, you should be sure that the person's heart is functioning. So for someone who just fainted, I'm 100% sure that the person's heart will still be working and the person's respiration will still be there. So the person doesn't need CPR. Most times, like I've witnessed in the hospitals, if they bring a patient like that and you check the person is breathing, the heart rate is good. Sometimes you even check blood pressure, it will be fine. So the next thing you need to check for that kind of patient is the sugar level. So that if the patient's sugar level is low, then you attack it and the person will just come back. I've been in the hospital when they rushed in a lady like that and we checked observation-wise, this patient was stable, but the patient was unconscious. When we now checked the sugar level, it was very low. We started off glucose IV, and within 2 minutes, she was fully conscious. And she told us actually she hadn't eaten since yesterday. So that is it. And the next thing I want us to know, though it is not very common in Nigeria, is that some people can actually tell you not to resuscitate them, even if they need CPR. Do not give them CPR. That was one of the cultural shocks I had when I came newly here. You know, some people will tell you that, in fact, though they are enjoying life, but they don't want to stay more than they should. Sometimes they'll carry it in their wallet and tell you, if in case I need CPR, please do not resuscitate me. So if you see that kind of thing, please, on no condition should you do it. Because if you resuscitate that person and the person recovers, the person can sue you. And you cannot pay the damages. Some people have been assessed and they themselves they have decided that they don't need the CPR, even in the hospital. You see in their patients' records, do not attempt resuscitation. Sometimes they even tell you not for hospital admission. So in that kind of situation, if the person goes into cardiac arrest or respiratory arrest, please just don't do anything. Though it's very difficult, but you don't have to do it. So those are the cases whereby even if you are sure that this patient needs resuscitation, but if the patient had told you that in case I go into cardiac arrest or respiratory arrest, please do not resuscitate me. Please, please do not resuscitate that person. Do we understand that? Why I'm saying it is that I know that most of you that are still students back home in Nigeria, one way or the other, you may happen to practice outside Nigeria. This is just what is obtainable. So whenever you come, before you even start doing a CPR for a patient, unless the person might have made that decision, but there is no indication. Maybe it happened in the shopping mall. The person does not have anything to indicate that you should not do CPR for that person. You should go ahead and do it. If they see you, you tell them that there was nothing to show or to tell you or to let you know that this person doesn't want CPR. So aside that, please, as much as you can, you have assessed and the person needs CPR, please start. Okay, what is the best position to place a patient that has fainted? Recovery position, that was, I think, the last two slides we showed before we ended the class. If the person has fainted, if any patient is unconscious, the best position is always the recovery. Unless you're doing the CPR, you can now lie the person flat like that and do your CPR. But once the patient is unconscious for any reason at all, and you are not doing CPR for that person, recovery position is always the best to avoid choking. Because if someone is unconscious, the person might not have that reflex to swallow spit or any secretion. And that secretion, if it goes into the wrong way, the patient can aspirate and die as a result of that aspiration, not as a result of the unconsciousness or the reason why the person went into unconscious state. So that is why recovery position is very important for you to learn, both as a student nurse and as a nurse. Once the person is unconscious and you're not doing CPR for that person, put the person in recovery position. If you're doing CPR for that person and the person has recovered with the heart rate and the respiratory rate, the next thing you should do for that person is to put that person in the recovery position. Any other question? Any other question? Okay. With this, we can end the first part of our session tonight. Whoever that has contributed, whoever that has joined this class, I wish you say thank you. Thank you. So I'm going to share my screen again because I promised this was going to be an information session. In as much as we'll have a class, free class today, we'll also have an information session where I'll tell us about what we are doing and how we intend to go about it. Okay, hang on. So permit me to share my screen again. So for the information session part of this class tonight, I want to tell you more, just some information about the group called the Nurse Mentor. You know, what we intend doing or what we are going to do is to help student nurses and student midwives, because we all know that most of the times, the time for our lectures in school may not be enough. Sometimes you have missed some classes. Sometimes there are some courses you don't just like, no matter how well. Or sometimes one unfortunate thing that is very common with the students is sometimes you don't like a lecturer, and it will affect the way you understand that topic or that course. So there are so many things that students pass through that they will need support. And that support, there is no how you can get it in school most of the times, because the lecturer will come and teach and go her way, go to her house. Sometimes the students need extra help. For example, the PTS group now, those student nurses that are just admitted, most of the schools have them now. And within the first 4 to 6 months, they write the PTS exam, and most of them are sent away in the pretext that they did not pass. Some of them are they're still trying to adapt to the new environment. Some of them are not used to the lecturing method of the nursing schools. Some of them are very brilliant, but they still fail because they didn't get the support they need. So this is one of the things we're going to do in the Nurse Mentor group. So we've got trained lecturers. So who we are now, let's just go through this. Who are these people now? We are a group of professionals, nurses and midwives, so not just other professionals, with rich practical knowledge coupled with excellent academic background. We are committed to helping student nurses and midwives achieve academic excellence and become better professionals in the future, because your future starts now. So we also provide all this support online. It's going to include classes and private sessions. If you want, the most popular is going to be the classes, where we'll group them. We'll get to how we're going to group them. But all the activities currently are online, because I've gotten several calls asking about where we are located physically. We are not physically located anywhere as a group. It may come in the future, but now all activities will be online. So our aim is to promote academic success. We are going to support the students to achieve their academic goals. We are going to give you the support you need. We are going to work with the Nursing and Midwifery Council curriculum, and we are going to make sure that we help you as much as you need that help. We'll help you to improve your study habits and your time management skills, because those are the two determinant factors. If you waste your time, in fact, time wasted, you can never regain it. So especially for the new students, we are going to try our best to help you know how to go about your reading, your studying, and then support you with all those topics, especially the ones you feel that are very difficult for you to understand. We are going to break them down for you. See, one experience I had when I was teaching was that none of my students Nobody that attended my class fails my exam. Because even if you don't read, like this class we had now, if you see any question under this topic, I'm sure you're going to answer them. So we're going to try our best to break those topics that look very ambiguous. We're going to try our best to break them down for you. We've got capable hands. We've got hands that have been tested and are trusted. So we are also going to help you to build confidence and competence, because we'll give you room for feedback. There are questions you may not want to ask even in the class. There are questions you don't have anybody to ask. So we'll give you room to ask those questions, and you'll be guided. You'll be given the feedback you need. So for those who are towards writing their professional exam, most of you who are in the nursing training schools, especially those doing the 3 years program, 3 years is just like nothing. Before you know it, the 3 years has passed. So you need to start preparing for your professional practice now. Don't wait until you graduate. So we are going to help you. We're going to support you to become a better professional. We are also going to build a supportive network for you. So network of fellow students, network of nurses and midwives who are always there to cheer you up and to support you, both academically and non-academically. There are going to, some non-academic activities are going to come up, but I'm not mentioning them now because we are not starting them immediately. So for now, we are focusing on your academic success. We don't want to hear that you failed any course when you could have sought for help and pass it. See, for those who just got the admission, it is not good to fail any course in School of Nursing. The depression alone will affect that person. The depression of one course can make the person to even fail other courses. So whatever it is that you have to do to make sure that you succeed, please try as much as possible to do it. So for the class groups we are going to have, like I said, everything is going to be online. The first group, the first one is going to be the newly admitted student nurses, those in the PTS class. We are going to have you as a separate group. We're not joining you with others because we believe you're still fresh from the secondary school. You don't know even anything about nursing. Most of you, the only thing you know about nursing is that the nurses give injections and nothing else. And is pardonable, is expected. So we're going to dedicate a particular class for PTS nurses. And see, the school fees you pay in that class is not something that you wish to pay and go back again and go home. I don't even wish it for any one of you. So whatever it will take for you to join this class, please do it. If it means convincing your parents or your sponsors to pay for you, the classes are going to be as subsidized as possible. It's just a way of us giving back to our country. But because we can't do it free of charge, like you see this class now, we have over, let me see how many people we have in the group currently. So currently we have 89 members in the group. But you can imagine how many people attended the class because it is free. So I've taken part in free classes. I've conducted free classes before. When I passed my IELTS, one of the promises I made to God was, God, if you help me to pass this IELTS exam at one sitting, I'm going to teach people free of charge. And I actually did it. I did it and so many people passed through me. But I noticed that so many of those people that would have passed did not take it serious because it was free. So that was when I said, if not that I've already made this promise to God that I wasn't going to collect a dime to teach it, I would have charged them. At least they will take it serious. So now that we said free class, only few people attended. But if people are made to commit some money, that is the psychology of Nigerians. So if they are made to commit something, they will make sure that they utilize that money and even utilize more than it. So that is why we are going to charge, but it's not going to be exorbitant. So your mind shouldn't skip. It's not going to be something you cannot pay for. So like I was explaining, we have the newly admitted students have explained it. And the next class we are going to have, the next group of class the members are going to be those ones that are preparing to write nursing and midwifery council exam. That's nursing council exam. Those in the School of Nursing preparing to write the exams. In this class, even everybody that has passed PTS can join the class, but the focus is to pass nursing council exam. Like I said, all our teachings will be focused on nursing and midwifery council curriculum. That is the next class. So people in first year, second year, third year can join that class. The midwifery council preparatory group will also be another group for midwifery students. And then aside the group classes, we're going to have small groups. Like if you have a friend and you people can organize yourself, maybe you have a problem with understanding pharmacology, just as an example, and you know 1 or 2 or 3 or 4, it won't be less than 10 anywhere for us to have those small groups. You have to be up to 10. If you gather yourselves up to 10 and you have a specific need, a specific academic need, maybe practicals, maybe foundations of nursing, maybe psychology, just any topic at all, any course at all. If you can gather yourself into that small group of not less than 10, you can make your choice of course, and we'll focus on that for your group. Then we're going to have private sessions. Private is, some people, they don't want stress or they don't want a disturbance. They just want you to teach them alone. We also have provision for that. So each type of class is going to be, it promises to be highly interactive and informative, and it's going to cover the essential topics. We're going to also solve past questions, especially for those classes, those professional exam classes. We'll solve extensive past questions that will get you familiar with the exam. For those groups, we are going to have monthly assessments. At the end of every month, we do assessments and give feedbacks. Then you'll be opportune to be in a community of like-minded people. So the price list, and that's always the bone of contention, isn't it? So for now, for the private or one-on-one classes, it's going to be as requested, as the person wants it. The topic is going to be determined by the person. The course is going to be determined by the person. But the person is going to pay per session, not per month. And each session of 2 hours, the fee is going to be 10,000 naira. It's just very optional. All of them are optional though. But if you know what you're going to get from it, you just see that it's very necessary you do it. Then the PTS classes. In fact, all the classes, we're going to hold them for each group. We're going to hold 2 classes every week. Every week we have 2 classes. and the class will just be approximately an hour and a half. I won't promise 2 hours, but if sometimes it may get to 2 hours, but just know that we are aiming at capping every class within 1.5 hours. And it's going to be 15,000 naira per month. 15,000 naira per month can save you from wasting the millions. I know that some people have spent more than 1.5 million to join that class, the school fees and every other thing involved. So if you're asked to pay 15,000 naira per month to be given that extra help you need, that may not be on the higher side. Then the same thing goes for those preparing for Nursing and Midwifery Council. Twice a week, one class will be capped at an hour and a half, and price is also 15,000. The same thing for Midwifery Council preparatory class. So that ends it for tonight. Any question? Any questions so far, so that we can call it a night? So if you're in the group and you know, I've been the one posting on the group. So if you want to join any class, just send me a private message. I'll tell you how to pay and when when we are commencing. No question? In the absence of any question, I think we'll end this class now. So, sorry, I wish us all the best in all our endeavors. Take care and have a very good night rest.